Today we will discuss the mental health disorder known as borderline personality disorder, otherwise known as BPD. We will discuss its causes, recovery for it, and some traits that a borderline personality disorder displays. Hi, my name is Travis. Let's get right into it. It is estimated that 1 in 100 people have a borderline personality disorder. BPD people face several issues when they have this mental health disorder. They have difficulty controlling their emotions, which is known as emotional lability. Not liability, lability, which is the uncertainty of self, which is known as an unstable self-image. Borderline personality disorder people can have unstable and unhealthy relationships repeatedly, which can involve idolizing people and going from that to totally disliking them or devaluating in relatively short interval periods of time. It doesn't take long for a borderline personality disorder to go from over here to all the way over here, just like that. That's why it's called the borderline personality disorder, because it's on the border of neurosis and psychosis. Feeling the urgent need to avoid being abandoned by people, even if the abandonment is only imagined, they still feel like it's happening. A chronic feeling of emptiness, repeating acting in an impulsive and risky manner. As you should be able to see by now, it is a picture of instability. To add to these challenges, BPD is normally unrecognized by other people or even the person that has the BPD themselves. With this being the case, certain services for BPD are limited. The reasons are ongoing social stigmas of mental health conditions or challenges that health professionals face in treating BPD. It is quite possible to treat it, but we're going to go into more of that a little later. So imagine a good friend of yours has borderline personality disorder. You tell them something about your new partner and they react to what you tell them ferociously. You have been hurt by them in one or more episodes of severe instability, and you might struggle to feel empathy for them. But it's important not to blame the person. It's not their fault after all. So what is the cause of borderline personality disorder? It is not yet fully understood. Currently, a combination of biological factors and early life experiences such as trauma is thought to contribute to the development of this disorder. In diagnosis, psychiatrists attempt to observe a pattern of these features that were mentioned before. These are considered inflexible, pervasive, long-standing, and must lead to clinical significant distress or impairment. In terms of recovery, the best treatment results have been shown a branch of psychological counseling known as dialectical behavioral therapy. It's a very intense therapy. It means concerned with opposing forces, which are about acceptance and change. Think of some challenges early mentioned and then consider how that might affect a relationship between a health professional and a person with borderline personality disorder. It is important to engage clinicians who have thorough experience of this condition. Give that the maintenance of a strong therapeutic relationship is integral to positive outcome. It may take several attempts at therapy, but strong improvements are possible. A lot of people don't understand this borderline personality disorder, but they do know that people can go from being extremely happy to being extremely sad. Just like that. That's why it's called borderline personality disorder. There is no known cure. It's still being under research. Treatment is limited based upon people's knowledge of this disorder and people's awareness that they have it or their friends have it, but it's a very serious mental health disorder. And that's why I wanted to talk about it, because I don't hear many people talking about it. And I have clients that have this disorder. Like anything I said, if you like anything I said today, hit the like button, subscribe button, and I will be covering more mental health topics in this series. Libra Man is out.